have with us Dr. Tanmay Gatak, critical care specialist from SGPGI Lucknow. And we welcome you to the Natco Pharma Specialty Criticon 2024 studio. We look forward to listening to you during this time for the advice to the young generation of doctors in the space of critical care management and especially those associated with bacterial resistance. What, as per you, are the changes or the challenges that you foresee in the critical care management?
I have seen several challenges. Like there is no strict protocol in Indian ICU scenario. Say a basic thing like hand hygiene, washing of hand before touching a patient, after touching a patient, that can improve uh, patient survival as well as decrease the resistance of infection. The notorious bugs that are rampant in the Indian scenario, just we are discussing about that in previous time, that in European or American scenario, these bugs are bit timid, what can I say, but now in Indian scenario, these are notorious bugs are there, and because of we are not having strict guidelines of uh, say hand washing, these simple thing, before giving injection you have to wipe the port and then give injection. These simple things that can prevent resistance, that can improve survival, that that we are in lacking, that we are lacking of.
So I think you are being critical on the hygiene part of it, and thank you so much for bringing that on. What is your advice to the younger set of ICU doctors in telling them what is the enhancement of patient care that they should be doing?
Be more vigilant, take all patient as personal patient, like is your parent, is your brother. That is the only way that can improve our that can improve patient outcome as well as doctors motivation and improvement of patient survival as well.
What is the prevalence of carbapenemus producing bacteria in your practice? What is the best treatment option?
It's growing high in our setting as well. Klebsiella and E. coli are we are getting carbapenemus resistant nowadays. Ceftazidime avibactam is a ceftazidime avibactam and along with that aztreonam and TG. These combination we are using mostly to combat this.
Any other insight that you want to share?
Very soon, if you are not using the proper preventive measures, very soon more and more resistance bug will come, and there is less antibiotic. Few antibiotics are there in next 10 years down the line. We are not having any of us. When we are going into the dead bed, no antibiotic will help us. Please understand the scenario and act accordingly. Act smartly.
Thank you so much, Dr. Gadak, for all your insights in critical care.